Sudan, the peaceful Sudan before the war, and it shows the uh, confluence, the Blue Nile and White Nile confluence. And thank you.
Thank you, Enos. I really appreciate you being the representative of what's happening in Sudan and explaining to us more about what's going on and what you're doing to deal with this humanitarian catastrophe. Um, we are running a couple of minutes over from session one, in part because I wanted to make sure as we were setting this up that we were covering speakers from every global conflict. And what I'm going to ask the four panelists from session one to do is I'm going to send you some of the questions in the chat to make sure that we can answer those questions that are coming up from all of those who are joining us online. And for those who have asked questions online, we're very grateful for your participation and input, and we will get answers to you from the panelists in the chat as we move forward here. So with that, Keith, I'd like to hand things over to you for a discussion about what's happening on the ground in Gaza.
Thank you very much, Dr. Gibson, and welcome everybody. That was a wonderful first session of outstanding speakers. Much thanks to all of you who have taken the time to participate in this really important CUGH online session that is virtual and open to everybody in the world. And this session, like all of the ones this week, will be shared globally, not only with our 36,000 person network, but also far beyond that. Now, as I said, I'm Keith Martin, Dr. Keith Martin, the Executive Director of the Consortium of Universities for Global Health here in Washington, D.C. And this session, the second part, is going to focus on solutions. And while we heard about the horrible situation in Nigeria, Sudan, Ethiopia, and Ukraine, this session, as Dr. Gibson mentioned, will focus on the catastrophe unfolding in Gaza. And I'm going to introduce the speakers in the order that they're going to speak. And I'm going to have a few introductory words. So the really outstanding panel that we have today of individuals who are extraordinary physicians in their own right, humanitarian physicians who have a lot of personal experience in the catastrophe in Gaza. And one will share their views on how we move forward and how particularly the children affected by that catastrophe can receive the care that they desperately need. So first, we're lucky to have Dr. Clay Dalton. Dr. Dalton is an emergency room physician. He's a writer for The New Yorker, but I'd encourage you to Google his name and take a look at all of the other amazing things that he has published in many other platforms. It's really outstanding. He's been on medical missions to Gaza and in other parts of the world. Next up will be Dr. Ehab Halawash. Dr. Halawash is a pediatric surgeon at the Nationwide Children's Hospital, an assistant professor of pediatric surgery at Ohio State University College of Medicine. He has worked in Gaza both prior and during the current horrible situation. He has done many medical missions, and he emphasizes medical solidarity with local surgeons through collaborative partnerships, hands-on training, mentorship, and enabling people to have dignified care. Finally, we have Dr. Feroze Sidhwa. Dr. Sidhwa is a general and critical care surgeon. He is also board certified in neurocritical care. He is a humanitarian surgeon who's worked extensively in Palestine, in Ukraine, but also in Burkina Faso, Zimbabwe, and Haiti. So you can see all three of the speakers we have today have extensive experience in Gaza, and we will look forward to listening to them about how we can move forward. But first, a couple of comments. And I wonder, Elizabeth, if you could put up my presentation. I just have a couple of slides and a couple of points I'd like to make before we start. While Elizabeth is doing that, I would just encourage you that this is a full week of virtual sessions, 16. They're open to all, and you can register for them at cugh.org. I would also encourage you to come to our conference, which will be in Washington, D.C. next April 9th to the 12th. And we hope that you can come there and work with individuals from around the world who are addressing contemporary challenges, including the one we're dealing with today. So, Elizabeth, could I have the first slide, please?
Yeah, Keith, can you see the title slide? Just wanted to
Yes,
make
I
sure.
can. I
Okay,
got
great.
it. Thank you, Elizabeth. All right. WCNSF. WCNSF. Wounded Child, No Surviving Family. That is a horrible, horrible acronym that is the reality of children today and these children in Gaza. And the depth of the tragedy of these children and the Palestinian people and what they're suffering today in Gaza, the fact that this acronym was actually put together to put some label on these children to find some way forward is a tragic and horrible indication of the trauma these children are facing and the future that they face. What will happen to these children? Although more than 20,000 children have been killed in Gaza and more than 40,000 have been officially injured, in reality, there's more than 1 million children have been traumatized in Gaza. There's nothing in Gaza. It's been devastated. So what is going to happen to these children? If you look into the eyes of these children, what will happen to them? If they were your children, what would happen to them? So the goal of this particular session is to figure out and advance a way for these children to be able to have the care and the dignity of the lives that they deserve to have, that they must have, like any children anywhere in the world. Next slide, please, Elizabeth. Here's the numbers that we know of. In Gaza itself, as I mentioned, more than 1 million children traumatized, more than 40,000 injured, some with horrific injuries that we'll hear about now. In Sudan, you've heard from our speakers before, thousands have been killed, 24 million children have been traumatized. And as you heard from our previous speakers, whether they're Nigeria, Sudan, Ethiopia, or Ukraine, we're living in a world of children that are being traumatized and who have no recourse to protect themselves at all. Next slide, please. So what happens to this child? What happens to her? How does she receive the care in an environment where there is no care? Next slide, please, Elizabeth. So here's one thing I want to posit. And I've actually approached the embassies in Qatar, UAE, and Saudi Arabia. At least now, at this moment in time, that's a part of the world close to where Palestine is, where these children can receive care. And perhaps if those who are listening to this from those countries, that they can think through how they can provide with the extensive facilities and resources that they have, that those children can actually receive the care that they need with their families and then be able to return back to Palestine as they wish. So I'd like to turn it over now first to, can I have one more slide, please, Elizabeth? Yeah. So if you'd like to help, here's just a few of some of the groups that I support and know. So some people ask, what can we do if we're living far away? Here's just a few, and there's many others where if you'd like to make a contribution, you can do so to help these folks. With that, I'd like to first turn it over to Dr. Clay Dalton, who will turn it over to Dr. Halawash, who will turn it over to Dr. Sidhwa. Clay, Feroze, and Ehab, thank you so much for joining us today. We're deeply honored, and I'll turn it over to you, Clay, first. Thank you.
Thank you, Dr. Martin. I just want to say thank you for the opportunity to be here and speak about the devastation in Gaza. As Dr. Martin mentioned, I'm trained as an emergency physician. I'm also a journalist. And I traveled to Gaza during the second ceasefire, which was January to February of this year, and engaged in clinical care of patients in the emergency department, but also spent a considerable amount of time traveling throughout the north, central Gaza, and surveying the damage of the healthcare system there, which is something that I've written about. And I'm going to focus my presentation today on that. It's extremely difficult to provide medical care if you don't have the infrastructure to do so. That's sort of the basic starting point for caring for children who are victims of starvation, victims of traumatic injuries from airstrikes, victims of other sort of second and third order consequences, health consequences from the conflict. This might be infectious disease. It might be something like diabetic ketoacidosis for insulin-dependent diabetic adolescent or child who can't access their insulin because the entire healthcare infrastructure has been damaged. And so I'll take you through some slides from our mission into Gaza, just to really sort of illustrate the extent and severity and degree of damage to the healthcare system in Gaza. It's truly extraordinary. And I think in terms of focusing on solutions, this is a really important place to begin in terms of restoring the ability of healthcare workers in Gaza to care for not only the children of Gaza, but the entire population. And it's going to be an extraordinary effort to rebuild what is there. Although I will say that even during the ceasefire was only days old when we entered the second ceasefire. And already people were working to rebuild the healthcare system with what little they had. It was extraordinary. And so provided with the support, the resources, the funding, the material, the equipment, I have no doubt that the people there will be able to restore the healthcare system as best they can. So I'll move into sharing my screen. Okay. Dr. Martin, are you able to see that screen?
Yes, I
we
can. Thank you, Dr. Dalton.
Thank you. So we'll begin here. So these are the dates of our mission. It was actually quite a short mission. It was slotted to be 2 weeks, but we were delayed in terms of our entry crossing into Gaza by several days. And so it was a shorter mission than most. And this is how we go in. People who have been on missions into Gaza probably recognize this scene. This is the Kerem Shalom crossing. And we made it on foot. You can see we're all carrying suitcases. It's all just full of medical equipment. Anything that we could carry, we brought with us. And on the other side, this is one of the things that we saw there was the consequences of displacement, internal displacement. This is a school that had been turned into a sort of makeshift shelter for probably hundreds upon hundreds of families. This is in central Gaza in Deir al-Balah. It's empty because once the ceasefire was announced, many of these people who had been displaced from the north were able to return back to the north. But you can imagine this sort of, I think, captures the degree of displacement within Gaza, and you can imagine the consequences for healthcare, medical attention when people don't even really have a place to live. In terms of additional consequences of displacement, these aren't patients. These are just individuals who have nowhere to live and who have been, I suppose you could say, fortunate enough to secure an extra stretcher or a bed or a cot or even just a pallet on the floor in corners of the hospital. And so the stairwells of the hospitals were sort of full of makeshift tents, sheets draped in the curtain for some semblance of privacy. And so this was, for these individuals, this was a relatively safe and dry and clean and warm environment. And then starvation. This is not one of my photographs because when I was there, aid was flowing into Gaza, and for the most part, there was adequate nutrition for most of the people who were there. Famine and starvation came later in the year after we'd already left, when food aid had been restricted. And the consequences of starvation are quite insidious, actually. This is something else that I've written about. The sort of acute consequences can be visibly very striking, and of course can cause death and disability and other complicating infections, so on and so forth. But there's actually a very long sort of tail of consequence, particularly for children if they've been exposed to periods of starvation. Even after the period of famine or starvation comes to an end, there are long-term consequences that seem to be locked in essentially for life. The younger the child, the more significant the consequences, primarily because children have such limited reserves when it comes to calories and nutrition, and because they are still developing. Their organs are growing, their brains are growing. And so if you deprive them during these periods of critical growth, then you can increase the risk over the lifespan of chronic metabolic diseases, cancer, mental health problems, etc. And in fact, the most vulnerable group is actually children who are in utero during the period of starvation or famine. So these are unborn children who were not directly exposed to a famine or a period of starvation, but their mother was. These individuals are very susceptible to increased risks throughout their entire lifespan. And so we'll move into some of the direct documentation of the consequences of the conflict for the healthcare system in Gaza. This is along a coastal road headed to the north. And so the hospital where I was based, working clinically, was in central Gaza, in Deir al-Balah, Al-Aqsa Martyrs Hospital. And I felt that it was quite important, if at all possible, to make my way north and to document the damage to the healthcare infrastructure in the north, for a few reasons. One, because many of the most important centers, hospital centers, referral centers, specialty centers, are in the north in Gaza City. And two, because this region had been subject to the most intense bombardment and devastation. And we had heard that the hospitals and healthcare infrastructure in the north had borne the brunt of the damage. And so this is me and a local coordinator for the organization that we were working with, making our way to the north. And you can see there are people who are traveling with essentially everything that they have left: pallets, beds, things of that nature. And the degree of damage in the north was extraordinary. This is representative. This is from one of the northern towns to the north of Gaza. And it's just a sort of uniform destruction, really. As far as you can see, there's almost nothing that is untouched, unfazed, and very little that is standing. And so it's hard to imagine people still trying to find shelter in places such as this. This is in Gaza City, outside of Kamal Adwan Hospital, which was subjected to direct attacks, shelling, airstrikes, and then was raided by Israeli forces, and then the hospital facility burned. It's not entirely known how that fire broke out, but walking through a burned hospital was especially disturbing. And you can see just the scale of the destruction is quite remarkable. In the back corner here, this is infant formula that had been destroyed. And you can see probably a crib here, medication vials on the floor. Patient rooms had been burned and destroyed. Moving up through the hospital. And Kamal Adwan Hospital had one of the few neonatal intensive care units in northern Gaza, which had also been destroyed, as you can see. So there are incubators here, panda warmers that had been destroyed. This is the operating room in Kamal Adwan Hospital as well. So also, as you can see, everything has been burned and destroyed. And then this is Al-Shifa Hospital, which is probably the most important medical facility in Gaza. It's in Gaza City. It is the sort of flagship teaching hospital in Gaza, and also a very important referral center. So many specialty services are available here. This is an earlier photograph of Al-Shifa Hospital during the conflict. And you can see that there are a number of people who have actually taken shelter in the courtyard, just on the impression that this would be a sort of safe haven, which has not proven to be the case in Gaza. Medical facilities there have been subject to targeted military action. And then by the time we arrived at Al-Shifa during the second ceasefire, it had been subjected to tank fire, shelling, airstrikes, direct military raids. And this is what it looked like when I arrived. Totally abandoned for the most part. There was the director of the emergency department had sort of reopened a makeshift emergency room in an outpatient building. And that was really the extent of the services that were offered there at the time. The main buildings had been completely destroyed and were totally abandoned. This was what was left of the old emergency department in Al Shifa Hospital, which was only actually a few years old before the conflict started, and was equipped just like any sort of modern Western hospital emergency department. Expansive, quite large, very beautiful, clean. You can actually see this is the director of the emergency department, Motaz Harara. And you can see this is a photograph of what the emergency department at Shifa had formerly looked like from essentially the same perspective where we were standing. Quite a change. This is a makeshift graveyard that you can see outside the back wall that has been blown out of the emergency department. And this is something we saw at every medical facility that we visited throughout the North. These would be patients who died when these facilities were under siege and there was nowhere else to bury them. They would be buried in courtyards, passageways, really any sort of spare patch of dirt. This is another one of the buildings at Shifa, which was totally destroyed. This is the main lobby or atrium of Al Shifa Hospital. A few other photographs. This was the front entrance. This is a makeshift grave at Indonesian Hospital, just to give you a sense of how limited they are. So we'll often see graves were marked with writing on a wall or on a piece of paper or a ceiling tile or a piece of rubble or debris. And then this is one of the more disturbing things that I witnessed on my time in northern Gaza. This is an Indonesian hospital. And in this facility, we were shown a room that was filled with discrete pieces of medical equipment, IV pumps, cardiac monitors, ultrasound machines, dialysis machines, et cetera, that seemed to have been systematically destroyed with gunshots directly into the screens. It's hard for me to imagine that this might have been collateral damage. It certainly seemed systematic and intentional. A few other devices. These are dialysis machines that were destroyed. And then I think just to close, what I'd like to focus on is, all of these various different ways in which the conflict has impacted the population in Gaza: destruction of the healthcare system, starvation, displacement. These burdens fall disproportionately on children just because there are so many of them. It's nearly half the population of Gaza. And so the toll that this conflict has taken on the population of children there is extraordinary and really hard to articulate, hard to grasp. And I also, while I was there, I saw many scenes of resilience, children finding ways to play and to continue to live their lives in the midst of the rubble. I saw children flying makeshift kites. Here we see children building presumably a little fort out of pieces of rubble, detritus. And so it was an extremely poignant reminder to me that children are incredibly resilient. And if we are able to support them in what they need, adequate nutrition, food, medications, healthcare infrastructure, the things that we take for granted in many other parts of the world, then they will find a way to thrive even in the midst of incredible hardship. They just need a little bit of help from us. And so this is us departing, again, walking out as we came with mostly empty suitcases, leaving as much as we could. And that's my final slide.
Thank you very much, Dr. Dalton. That was a poignant. Thank you for your service, number one, and thank you for sharing. It's difficult. I can't imagine. But in sharing, you're giving voice to the voiceless, and we're truly grateful for that.
Thank you.
If you're able to stay for 10 minutes after, because I know you're in a tight timeline, that we'd appreciate that. But if you have to go, please do. And with that, it's our honor to turn it over to Dr. Ehab Halawash. Dr. Halawash, thank you very much for joining us today, and the floor, sir, is yours.
Thank you, Dr. Martin and Clay. Can you guys see my screen?
Yes, we can. Thank you.
So, thank you again for this privilege to speak with you guys here. Just briefly about me. Although I was born in Cardiff in
Apologies
Wales,
for interrupting you before you start, but we're seeing the presenter view. If you'd like to just
oh,
switch, it's
sure.
yes, I think if you hit play from start. Oh, okay, at the bottom, do you see those five? Oh, sorry. Go ahead.
Is that better?
Yes, thank you.
Cool. Yep. So I was born in the UK and I grew up in Egypt mostly until the age of 12 when I moved to South Dakota. When I was in medical school, I decided I wanted to be a pediatric surgeon, which is an additional 9 years of training. So I did general surgery at the University of Michigan and 2 years of pediatric surgery in Texas. And as pediatric surgeons, we treat infants and premature babies all the way up to young adults. And we focus on congenital defects, childhood cancers, but also trauma and basic conditions. So my journey working in Palestine began in the summer of 2017. I was near the end of my general surgery training, and honestly, I was quite burnt out and feeling disconnected from my purpose. And I wanted to find a way to give back and especially serve folks in need, in places that and community that have shaped me. So I decided I wanted to focus on treating patients in Palestine. I was able to organize a 2-week mission with PCRF to Hebron with a surgeon and an anesthesiologist that I trusted. And the following year, I returned to Nablus, this time in the northern West Bank, a beautiful city, where we also had a great mission there. And these 2 trips kind of early on in my career were quite impactful and really shaped kind of the vision for my career and my trajectory. After COVID, PCRF asked me to return to Palestine to perform a needs assessment. So I spent 2 weeks traveling in the West Bank, visiting all the Ministry of Health hospitals that perform pediatric surgery. And I got to meet with all the pediatric surgeons, a lot of administrators, and really understand kind of what are the issues that they were facing there. And this opportunity allowed me a permit into Gaza. So that was my first trip into Gaza in the summer of 2022. To Shifa Hospital, which Dr. Dalton had mentioned. This was really the premier kind of hospital in all of Gaza where you could receive specialized care. So I spent time there with the pediatric surgeons, trying to understand what are the issues they're dealing with, where can we help to grow the capacity there. Just briefly, and this may be familiar to many of you, but this is all pre-war data. I just want to show you how dire the conditions were already before the war. But Gaza is a very small, densely populated area. It's 2.1 million people, and a strip about 25 miles long by about 4 to 7 miles wide. And it's a very young population with a median age of 17 years. Very high poverty rates. At least half the population is considered, under poverty with difficulties in meeting basic necessities, and some of the highest unemployment rates in the world. Most households received about 48 hours of electricity per day, so there's always constant electricity cuts, and most of the groundwater was unsafe to drink. So most people depended on water trucks bringing in water to their homes and to the hospitals, of course. So some of the challenges, facing the field of pediatric surgery in Gaza is, first, there's a very high incidence of congenital disease. So, and this is higher than many areas around the world. So it's about 8 to 9 cases for every 100 birth almost. And some of the factors that play into this are genetic issues. It is a closed off area, so there's a limited gene pool, but also environmental toxins and poor maternal health. And compounded with that, you have very high neonatal mortality rates. So not only are we dealing with babies that have congenital anomalies, but we have very high mortality rates in the NICU. And these account for almost half of the under 5 death in Gaza. And then on top of that, you have very limited OR capacities. So that leads to very long wait times for elective surgery. So before the war, if you had an elective condition, you had to wait a year to a year and a half to have surgery, and that includes children and adults. So you can imagine that time that you're waiting. Patients are deteriorating, diseases are getting more complicated, which then makes their surgery and their outcomes much more difficult. And really, the area that I was focused on was there was a severe lack of specialists. In all of Gaza, there were 2 surgeons that were considered qualified to perform the necessities of pediatric surgeon, and then there were several that really could just deal with the basics. So there's a huge shortage of pediatric surgeons, and because Gaza it was closed off, there's no way to folks to travel and become specialized. So in 2022, Shifa Hospital started a pediatric surgery training program where they would train 3 residents a year, and this is where I became involved to help train the residents and form a collaborative partnership. My mission was to strengthen pediatric surgery in Gaza through collaborative partnerships, hands-on training, and mentorship of the trainees. So what we started doing was, we obtained access for the trainees and the surgeons to online literature, educational tools, published guidelines. And we started holding a twice-a-month conference where we brought surgeons together from Gaza and the West Bank, and some of these folks had never even interacted before. And we started having these conferences to share cases, to discuss challenging patients. And then we developed an in-service exam, and we started planning twice-a-year visits where I would go to perform complex cases there in collaboration with the surgeons and to train the residents and the junior surgeons. So I had 2 missions in 2023 to Shifa and the European General Hospital, and these were really very fruitful missions. We had some very complex cases that we dealt with, and we were able to spend a lot of time training and working with the surgeons there. On October 6th, this is a picture of me checking in on the team as they were performing a laparotomy. So I said goodbye to the team and I exited Gaza to fly home. And obviously the next day, the war broke out. And some of this data has already been shared, but at least 70,000 Palestinians have been killed and 170 injured. There's many more under the rubbles. And there's still death going on since this ceasefire. And most Gazans have been displaced. When you talk to folks on the ground, almost no one is living in their original home. And the few that are extremely lucky. And many people have been displaced more than 10 times during the last 2 years. There's been at least 1,700 healthcare workers that have been killed. And as Dr. Dalton showed, the damage to the infrastructure is just unprecedented. There are really very few hospitals left standing, and those that are standing are at best partial capacity. So, like I said, Dr. Dalton showed some images of the destruction. These are 2 hospitals I used to work at. Shifa was destroyed early on, and the European Gaza Hospital later on in the war. So I was with Dr. Dalton in the January trip. We were there earlier this year during the second ceasefire, and I was able to return recently in September and October, right before they announced the current ceasefire. But some of the challenges that he alluded to were, it's difficult to get these spots to get in. The security clearances can be very difficult to obtain, and they now are rejecting about 75% of the physicians that apply. And they actually limit what you can bring in. In January, we could bring in suitcases full of stuff, but our last trip, we were not allowed to bring in any surgical equipment or even food. So during these last 2 missions, I was in the south of Gaza working at Al-Aqsa Hospital, but also Nasser Hospital and the European Gaza Hospital. And if I were to describe the state of pediatric surgery, I would say it's near collapse at this time. There's few surgeons remaining, and that's because of displacement, hospital closures, but also these surgeons are people, and they've had family deaths that have now forced them to stay at home or in their tents to care for their loved ones. And also some of them are just burnt out. You can imagine 2 years of this constant nightmare. It's a lot for a surgeon to handle. And during these 2 years, there's been almost no elective cases. So there is a severe backlog of children that need surgery for congenital anomalies or basic issues, and even just sequela of these traumatic injuries. And there's just a severe shortage of pretty much all essential surgical equipment. This was a typical kind of scene during my time there in this last mission. There was constant bombing, after which you would get these mass casualty events. So you get all these ambulances that descend on the hospital. This is at Aqsa Hospital in the center of Gaza, which is kind of one of the main trauma centers right now. And during these mass casualty events, our job was to walk through the ER and to identify children that are injured, that need surgery, but also children that have injuries that are non-survivable. And these scenes, they can be quite difficult to process. And I do want to just say that there will be some potentially graphic images, so just as a warning for viewers. But we could spend the next hour talking about the trauma and all the injuries in Gaza, but I really want to just spend a little bit of time focusing on what happens after the trauma, because for many children, the initial trauma is just the beginning of a long and difficult journey for them and their families. This is Yusuf. Yusuf is a 12-year-old who was playing in his tent. You can see here a picture that his uncle was showing me. A missile landed right in the middle of the tent, killing everyone in his family. And he was operated on at Field Hospital, and then 10 days later transferred to our center. And when I first met Yusuf, his incision had broken down. You can see intestines were protruding from his incision. And on top of that, he was leaking stool from his flank where he had a shrapnel injury. So we had to operate on Yusuf emergently to get in there and find the area of try to get source control and try to put him back together. And this is not a unique story. There are many children just like Yusuf who, because of their very poor nutrition before these injuries happen, which is then compounded by further worsening of the nutrition after the surgeries. They then have breakdown of all the repairs. They have surgical site infection. In fact, almost every patient gets a surgical site infection in Gaza at this time. So these children then have to have subsequent procedures to repair some of their original surgeries and try to get damage control. And on top of that, many of these children will have orthopedic injuries and soft tissue injuries and that need further surgeries. This is Omar. Omar was a 13-year-old whose house was hit by a tank, and he had to have emergency surgery. Had multiple injuries to his intestine, and unfortunately, a lot of these repairs broke down. So he developed what we call intracutaneous fistulas, where parts of the intestine had opened up, and he had unfortunately very limited intestine, so couldn't really have a full amount of nutrition. And the only reason he survived was that his mother was continuously basically feeding him almost on the hour just to get enough nutrition in him to survive long enough. And it took us 5 hours to be able to reconstruct everything. And he was lucky to go home, or really to his tent a few weeks afterwards. And these are all children that sustained traumatic brain injury from various types of injuries, and these children in the best of conditions can be very challenging to deal with and require high resource type care and rehab. And unfortunately, in Gaza, this simply just doesn't exist. So all these children were basically kept alive long enough in ICU to subsequently die from sepsis. But obviously, we're focusing on all the traumatic injuries, but what about all the kids that have congenital and non-traumatic injuries? Well, these kids really have very limited access to care. And this is just one example of a child, a 3-year-old, that I met this most recent trip. He was having severe respiratory distress for a period of several months. And you can see here he has what we call abdominal breathing. He's using his abdominal muscles to breathe. And he had been having such severe distress, he was starting to lose weight and really struggling. So his mom brought him to the hospital, where we discovered a very large cyst coming off of his lung that needed emergency surgery. And there's many children just like this child who simply just don't make it to the hospitals in time. As pediatric surgeons, we often rely on parenteral nutrition. So for the non-doctors, that's IV nutrition that you receive when you can't have nutrition through your gut. And these are examples of babies that we operated on that have intestinal atresia. These are congenital conditions where intestine doesn't develop normally, and it can take weeks, and if not months, for the intestine to recover and for them to be able to have formula or milk. And the only way we can get these children to survive is with TPN. Unfortunately, in Gaza, that just doesn't exist. So these children all became weak over time, and unfortunately, they died from sepsis as well. And the last story I'll share with you is about Sham. Sham was a 2-year-old that I met in January. She had Hirschsprung disease, which a colorectal condition that affects the colon, and these children need resection. And there's a lot of these cases that we deal with in Gaza as a higher incidence than most places in the world. But we operated on her in January, and she had a great recovery. And she, in March, they were living in Rafah, and she developed a severe gastroenteritis. So she started having a lot of diarrhea. And because of military restrictions on movement, they could not bring her to the hospital at night. So they had to wait till the next morning. And by the time they were able to find transportation, she had already died. And there are many children just like Sham who have very easily preventable, very easily treatable conditions that, and their deaths can be easily prevented, but they cannot reach care in time due to restrictions on movement of people and really all the closures of the hospitals in Gaza. So I know it's kind of a heavy presentation. I don't want to just, show all the destruction, but I do want to just offer some, actions. And this is not something I came up with. This is really what a lot of groups are prioritizing. But for the immediate kind of needs, we really need to reopen and streamline the crossings for medical supplies, because even now there's still a huge shortage of all these things. And we need to continue to deploy mobile and field hospitals and bring in emergency surgical teams. And we need to certain things that need to be prioritized for the hospitals, such as the blood banks and the dialysis units, as well all the surgical needs. And then kind of in the short to medium term, the infrastructure obviously needs a rapid repair to expand the healthcare access, and all the supply chains need to be rebuilt. And just focusing on workforce continuity and well-being is a huge task on its own. And there are many groups now working on telemedicine partnerships and kind of special mentoring type relationships. These are the things that we can spend hours talking about, and I hope we do have the opportunity to do so. And I really draw my inspiration from the folks on the ground. These are just some of the examples of the surgeons, or some of the pictures of the surgeons that I've had the privilege to work with. And really, they're all heroes in the way they've shown up during the war, and the way they've shown resilience, and honestly, in ways I just can't imagine. All these folks have suffered. Dr. Possam here on the left, he lost his entire family early on in the war, and he told me he was completely burnt out and just unable to work for several months, but really had to find the strength to come back. And he's a thoracic surgeon and also a hospital. He does amazing work there every day. Dr. Omar in the blue scrubs, he was a pediatric surgeon at the European Gaza Hospital. His brother, who was in Rafah, him and his wife were shot in front of their children, and he now takes care of these children. But he has continued to work, and in fact, he was living out of the hospital for 3 months with his family during the war, and he worked the entire time and provided amazing care to his patients. So there's many stories like this. If you just walk around the hospital, I mean, everybody honestly is living out of a tent. Everybody's displaced. Everybody's suffering, but they've all shown up in really amazing ways. And really, when I think about the situation in Gaza, it's hard for me to be hopeful, to think of a better future. But when you see parents in Gaza and you see how they show love for their children, and they fight for their children, and they protect them even when they have nothing, you really can't help but feel inspiration and to feel the hope. And I think we need to honor their resiliency, and by showing up, by continuing to advocate and continuing to work so that these children can have a dignified and beautiful life. So thank you so much for this opportunity, and hopefully we can have some time for discussion.
Dr. Halawash, thank you very much for sharing the story, what you've done, what you've seen, and the stories of Sham and the surgical heroes that you work with, individuals who we cannot imagine the resilience, what they've endured, and the resilience that they have exhibited for the care of their fellow Palestinians. It's a human story, a beautiful story in the midst of unspeakable tragedy. And thank you for giving us and sharing paths forward, which is what we are going to get into in the Q&A at the end of this, and what we can actually do. And with that, I'd like to turn it over to Dr. Feroze Sidhwa. Dr. Sidhwa, thank you again also for joining us today and for sharing your perspectives on child casualties in the Gaza Strip and what we can do moving forward. So, sir, the floor is yours. Thank you.
Thanks. Hopefully you can see my screen okay.
We can.
So I was asked to mention a few things about myself, but I think in general, my attraction to global surgery and humanitarian work is it just kind of came out of my life's experiences. I happened to go to college in the year 2000, and that's when the Second Intifada broke out. It was a politicizing time, and I ended up also working in Hebron actually as a medical student, and even before that, as a after I graduated from university, I actually lived in Israel and the Palestinian territories for about a year. And I think these things kind of, your life just kind of shapes you into someone who can probably do some good in a particular situation. And when that situation comes around, it's worth taking action, I think. And I'm hopefully doing that to some degree. This was already kind of talked about the particulars of Gaza before October 7th, but just not again, I don't want to rehash everything Ehab said, but Gaza is an incredibly small, incredibly densely populated, incredibly poor place. In 1948, about 250,000 Palestinians were expelled from the newly created state of Israel into the Gaza Strip, and there were only about 80,000 people who lived there. So today, about 70% of people who live in Gaza are the refugees or their descendants. It's also a very, very young place. Like you have said, it's about 50, well, who knows now, but before October 7th, about 51% of people were under the age of 18. Very few people were over the age of 65. There were some, but not many. Extreme political repression since not just 1967 under Israeli occupation, but even since 1948 under Egyptian occupation. Since 1948, and again, including under Egyptian occupation, plenty of Western visitors who have gone to the Gaza Strip have described it as a concentration camp, including Israeli generals, including American military men, including UN representatives, including Israeli sociologists. It's really quite a remarkable thing how many people that same image crept into their mind of Gaza as a concentration camp. We all know that it's under military occupation. De-development is something that it's kind of a unique phenomenon that's been undertaken in the Gaza Strip under Israeli occupation. If anybody wants to read about it, Sarah Roy's book, The Gaza Strip, The Political Economy of De-Development, is definitely the best resource on the topic. But it's kind of amazing to see the systematic and really sustained effort at destroying not just Gaza's, but all of Palestine's economy as it could possibly be separate from Israel's. And finally, since about 2007, Gaza has been under a land, air, and sea blockade, which really has no precedent in modern history. Since then, since October 7th, Gaza has become just kind of a different planet from anything else that's going on in the world. Gaza is one of the deadliest places, or Gaza is the deadliest place in the world for both civilians and aid workers. It's also one of the most dangerous places in the world to be a child. There are plenty of places in the world, like we've heard about Sudan, we've heard about Ethiopia, there's Congo, there's Myanmar, there's South Sudan. There are so many places where children are bearing the brunt of adult human viciousness. But Gaza is in some ways unique. Uh, Gaza is an incredibly deadly time for journalists. I actually was just writing something for an American news site, and I noticed that as far as anybody can tell, it's actually more dangerous to be a journalist in Gaza than it is to be a Hamas fighter. Gaza, the Clay really showed the just absolutely fantastic destruction of the Gaza Strip. There's nothing to this degree. There's nothing that's ever been done to a built-up area like this. Just so people understand, something like 80% of Gaza's buildings are damaged or destroyed, and by damage doesn't mean a bullet hit them. It means they're unlivable. That's far worse than just the destruction even of Hiroshima after the atomic bombing, which again is quite a shocking thing. Gaza's easily the thirstiest place in the world, at least of 2 million people. Oxfam has estimated that since October 7th, there's been less than 4 liters of water per person per day available in the Strip, and not for drinking, but for all things humans use water for. And incidentally, none of it has been fit for human consumption. I think we all know about the declaration of famine, which I could say a lot about, but we all, famine's bad and it's been going on in Gaza. Gaza is probably one of the most wounded places in the world. It's hard to find comparative statistics, but it'd be surprising if there was another close example. And finally, Gaza has undergone what has to be the most direct and sustained assault on a healthcare system that has ever happened. At least since the time of Genghis Khan. This is just to illustrate for people the situation of famine in Gaza, because we all know famine affects children primarily, or not primarily, but most severely. If nothing is done, and so far as anybody can tell, really nothing of substance has been done to reverse this problem. Most of Gaza, if not all of Gaza, will be in famine now. Basically, we just don't know because there's actually no way to really collect data. Even the IPCC's own attempts really have failed, and they had to make kind of a presumptive diagnosis of famine in May when they put this information out. And then just to illustrate the degree of the assault on the healthcare system, prior to October 7th, 2023, Ukraine was the world's deadliest conflict for healthcare providers. In that, this information all comes from the UN Humanitarian Data Exchange. In the 1,216 days of the war in Ukraine that's included in the database, it's up till July of 2025, the 310 healthcare workers have been killed in Ukraine. You can see that rate of killing over on the right side. In Gaza, in about half the time, about 673 healthcare workers have been killed. And like Ehab said, it's actually over 1,700, but this is what's captured in the UN database, and this is comparing apples to apples. That's happened in about 628 days, and if you adjust for the size of the healthcare workforce, the rate of killing of healthcare workers in the Gaza Strip is 100 times higher than it is in Ukraine. This is just completely outrageous. We don't have good numbers from Tigray, from South Sudan, from Yemen, from other such places, but it's unlikely that this level of killing is matched anywhere else. And again, I just want to be clear. That is not to say that the killing of healthcare workers is okay in those other places or that it should be tolerated. It absolutely should not be. But this is to illustrate because, and I'm an American, the United States is deeply involved in this, and this is one of the most severe, if not the most severe, such attacks on healthcare that's going on anywhere in the world. And then I know we're short on time, so I won't go into the extreme details of this, but these are all of the comparisons that I can find for armed conflict in the last 20 years that even remotely compare to the killing of children in the Gaza Strip. And the Russian invasion of Kharkiv and the Russian air attack on Syria those have both been studied very intensively by a British non-governmental research firm called Air Wars, and so have the first 25 days of the attack on Gaza. And you can see the differential rate of killing of children in these, again, population adjusted. The rate of killing of children in Gaza is orders of magnitude higher than it is in either Ukraine or even in Syria in 2016. And Syria in 2016 was the deadliest air campaign Air Wars had ever studied prior to Gaza. There's just it's just a shocking level of child killing that is happening right in front of our eyes. And I think it'll probably be best if we get to questions and answers, but I think we should all ask ourselves what it means about our own societies that we are, and especially the Western societies, what it means that we are so deeply involved in these kinds of actions against children, and not only what it means about our willingness to help them or to rebuild or to do something like this, but even just to take our boot off of their neck is something that I think we should all consider.
Thank you very much, Dr. Sidhwa. That was another outstanding presentation, gripping, direct, and focused. And you really laid out that this catastrophe is unmatched in history, in modern history at least. With that, I'd just like to start with a simple question for all of you, and we'll go in the reverse on solutions. And all of you shared some of them. But I wonder if you could share with us what we could do now and what pressure we need to enable children, to start off with, to be able to receive the care that they need for the acute injuries they have, but also for the ongoing care that they cannot receive. Where do we go? How do we get it? What are the next steps so those children that you've all shown pictures of can receive the care that they have? And I'll start maybe with you, Ehab, and then go to Clay and then Feroze. Ehab, please.
Yeah, I mean, I think in terms of what we can do here on the ground, obviously advocacy is kind of the main tool. It's pressure needs to be placed, and I don't want to get into politics, but there needs to be pressure placed by Americans because as Dr. Sidhwa and Dr. Dalton mentioned, we are kind of the primary folks funding this genocide. And I think we are responsible to find ways to end it. So I think it's going to come from the people, using their voice collectively to advocate and to push the politicians into action. And that's easier said than done. And I'm worried because I think the movement is losing some of its momentum. We don't see it Gaza being talked about in the news anymore, even though there's still ongoing bombings, and even though the conditions really haven't improved that much. So I think it's going to be grassroots movements to pressure politicians to affect change, which unfortunately is not going to be a quick solution. I think it's going to take a long time before the U.S. changes its policy.
Thank you, Dr. Halawash. Dr. Dalton.
I very much agree with what Dr. Halawash was saying. I think that we're in an interesting moment, I think, in the conflict right now. It does look like there is very slow evolution on the part of American politicians in terms of acknowledging what has actually taken place in Gaza and our role in it, actually on both sides of our political spectrum, which is quite unusual. But I think we run the risk of having arrived at what seems like a ceasefire that may have some staying power. It begins to fall off of people's screens, out of their awareness. And I think there's a risk that it starts to lose the attention that it still very much needs. And so I think, what can people do? I think that Americans do have a sort of outsized role to play because of the role that our government has had in sponsoring the conflict. And so I think that for people in the United States, remaining active and vocal in terms of applying pressure to your political leaders, call your representatives, call your senators, write letters, apply political pressure in an unyielding fashion. And then I think also just keeping the issue alive in terms of talking about it, friends and family, maintaining awareness, sharing what you know about it, perhaps something that you learned from these presentations here. The detail that was provided by Dr. Sidhwa and Dr. Halawash is just searing. And what can we do with that aside from sort of be shaken as people? We can maybe take some of those details and use that to share. I think attention is the most important resource in terms of directing real material aid. If nobody's paying attention anymore, then I don't think much aid will follow. And what is really needed ultimately is lifting of the restrictions on material aid that are coming in. There's need for everything, to rebuild, to reestablish the healthcare system, to reinstate support for children for all of their various needs. There's just you can't do that without things that need to come in from outside. And so there must be improvements in aid flowing in. Thank you.
Thank you, Dr. Dalton. And these are political choices, one way or the other. So, as you said, we can use, particularly humanizing the stories and using the human stories. You can't but hopefully be moved by them. I'm going to go to Dr. Sidhwa, and then I'm just going to because in the interest of time, because I know you all been very kind with your times for overtime, so I'll just go back and backwards and give everybody a minute to respond, if that's okay. Please, Dr. Sidhwa.
Yeah, I think we have to, and Ehab said he doesn't want to get into the politics, which I understand, even though he's wearing a University of Michigan lanyard in Ohio. But we have to, and everybody has to take their own ability to manage risk and things like that. I understand that, but there's an Israeli Holocaust and genocide scholar named Raz Siegel. He wrote a good article in the London Guardian just 3 or 4 days ago. Um, and he's, and this guy's a Holocaust scholar. He actually wrote, we don't live in a post-Holocaust world of never again, but we live in the same world that led to the Holocaust of again and again. He kind of goes on to point out that it's an interesting analysis, I think, that and this only applies to the Western powers, obviously, but the factors that led to the Holocaust were white nationalism and nationalism itself, or kind of the desire to create homogenous ethno states. This is a very, very ugly idea that has led to some of the world's greatest atrocities. And Segal himself says that the kind of the crowning manifestation of this is Israel's ongoing assault on the Palestinians. Uh, and he says that the Nuremberg trials didn't address this, the Tokyo trials didn't address this. No process, no actual mechanism that we've ever had in the Western world has ever addressed these problems. Um, and he actually goes on to say that in this context, for Israel and its supporters, the Gaza genocide is a model. Now, those are his words. But he goes on and he says, and I'll just quote him and then I'll stop talking because it's worthwhile for people to hear. But most people around the world don't want this future or this present. Most people see through the doublespeak of their leaders who claim to meet in Sharm el-Sheikh to make peace as they continue the flow of the means of destruction. Most people know that their governments, left and right, don't represent them, don't even care for them, nor for the future of their children. It kind of goes to what Ruth was mentioning at the beginning, that the French general was saying, you have to get ready to sacrifice your kids in war. Well, it's up to people themselves. He says, most people know that day is not night, and they refuse to say otherwise. And many, many people around the world have taken to the streets, risking arrest, violence, loss of jobs, facing stigmatization as anti-Semites, and driving apart from family members and even close friends. But they have shown up, and they continue to show up because the struggle continues for Gaza, for Palestine, for their lives, and indeed for the entire world. And I think that's correct, essentially. I think we have to show up, and I think we have to just decide to take charge of our own lives. Otherwise, we're going to continue to subsidize the mass murder of children in Gaza and plenty of other places.
Thank you very much, Dr. Sidhwa. That's spot on. And it's a powerful call to action. So I'm just going to go, just because we run out of time now, but I would like to make sure that each of our speakers, those that are on from the first session that Dr. Gibson led, and those on this session, that you have a minute for any closing comments. I'll start with Dr. Ines, Dr. Martha, and Dr. Tunde, and then we'll go to Dr. Dalton, Dr. Halawash, and Dr. Sidhwa. Dr. Ines, please. If you have a minute.
Yes, thank you. And thank you for the whole doctors that are providing, the heroes that are providing their services for the children and individuals who are in need. Well, I just want to say that the war definitely leaves an invisible marks inside of us, inside of children, families, and this can be over generations, not only just for children. And yeah, we should try our best to prevent children from witnessing this or being part of this. And we have a Sudanese proverb that's one hand cannot clap. So when we gather, that will be more efficient for supporting children. And thank you.
Thank you very much, Dr. Mustafa. Please, Dr. Martha.
Okay, okay, thank you. I'm so honored again to listen to those amazing speakers, their work, their extensive work, incredible work. Yes, I would say that the solutions are at our hand, on our political leaders. US is, we know that US is a world leader, so the governors should put pressure on our leaders, and also still US can act as a mediator, not only pressurizing the leaders, also can act as a mediator, because there are calls from both sides. It's not going well. It's not going smoothly. There are like in and out. So the mediator should be a world leader who can put pressure on politicians. And so, for example, US aid, there is a cut of fund from the US aid is further fueling the problem. So those funds are very important to give temporary solutions for millions of lives living in poor countries like ours. So I would say that US governors kindly reconsider those US aids and other donations to help millions of lives in Ethiopia, because they are dying of malaria. People are dying of HIV, and other maternal child health services are not going well. So I would say that it's on US hand and other governors who can put pressure on politicians. Thank you.
Thank you very much, Dr. Solomon. Dr. Ogunbozi, please, if you were still on.
Yeah, thank you again for this opportunity to join this distinguished audience. And thanks to all the doctors and all the great things you're doing out there. I think we've all said pretty much something similar, or a common theme, and that's holding leaders accountable at whatever stage or forum you want to speak to. In Nigeria, definitely some of the pressure from the US government is hopefully yielding some results. But I think also in all the places that we've talked about, it's down to our leaders, whether we elect them or choose them or not, doing the needful for the betterment of humanity and the good of our children and our women. And the more pressure we can put on them to do the needful, I think the better. This crisis, this mayhem, this assault on our humanity has gone on for far too long. And it's still down to the leaders doing the needful. And we just have to find ways to hold them accountable. Thank you.
Thank you very much, Dr. Ogunbozi. And we'll turn it over to Dr. Dalton, please.
Thank you, Dr. Martin. I'd just like to say that I'm profoundly humbled to share this panel with the other physicians who have spoken. Truly heroic, selfless work in all of these various conflict zones. And so I want to thank each of them sincerely, wholeheartedly for the work that they continue to do and have done. And then I would say that I think as important is continuing to bring awareness, attention, and light to these situations. And so thank you to CUGH and to you, Dr. Martin and Dr. Gibson and everyone else who's been involved in putting this together. I think sharing with the world what we've seen and what we know, I think is one of the most powerful avenues to change. So thank you.
Thank you very much, Dr. Dalton. Much appreciated. Dr. Halawash, please.
Yeah, I was actually just going to echo what Dr. Dalton said. There's a need to continue, I think, to advocate and to document what's happening. And I was inspired by Clay's journalism and the work that he's done. He's one of the kind of the few people that's been able to document kind of destruction in northern Gaza through his New Yorker timepieces, and also been inspired by some of the work that Dr. Sidhwa has done in amplifying the voice of folks on the ground in Gaza and really speaking out. So I think we need to continue to do that, especially as we mentioned with the ceasefire. It's really going to take away the spotlight from Gaza. I think we need to keep pushing people's stories and continue to advocate for them.
Thank you very much, Dr. Halawash. Dr. Sidhwa, you get the last word before Dr. Gibson and I do.
Yeah, I think it's just important for everybody and this panel really adds to this. Like I learned a lot from listening to all of you actually. And we need to know what is driving these conflicts. Otherwise we can't stop them. We can bandage people up afterwards, but it's better to just stop them from being shot and killed and raped and all sorts of other horrific things that are being done to everybody. And that's I think why this kind of panel is so useful, you know, so people can learn about Sudan, Nigeria, Ethiopia, Congo, Myanmar, Syria, Ukraine. You could go on with the list, unfortunately. Um, and I just would encourage everybody to take the information you've learned and try to actually put it into action. Try to petition your policymakers. Try to make your neighbors understand what's going on. Cross disciplines. There's no reason to stay in the silo of medicine. There's not that many doctors in the world, but there's a lot of other people. And and yeah, I think we can make a difference if we choose to, but it takes stepping outside of most of our comfort zones. Like you know, Clay's a trained journalist, so maybe he's different, but I personally don't like being involved in that kind of work, but it's unfortunately it's just necessary. It's another part of our at least in the West, we all take the Hippocratic Oath, and that involves some measure of advocacy for your patients, which is just necessary.
Thank you very much. Thank you, Dr. Sidhwa. And that's what Rudolf Virchow said, right? About politics being a social science. You're carrying a larger stethoscope once we get into politics, which is just where we should be. With that, I'll just turn it over to Dr. Gibson for a final comment before I close it up. Please, Dr. Gibson.
So I'd like to thank all of the people who have joined us online and who are watching this panel recording after the fact. I think that one of the main lessons for me in listening to all of this is the importance of even one individual's work in bearing witness to what's happening on the ground, and the importance of understanding these geopolitical forces. One of the things that Keith and I were discussing as we set up this panel was this session is, you know, one one piece of work, and kind of collectively we are moving forward in a variety of initiatives. One of the things that's come up a number of times on the chat and on the feed is for individuals' emails, addresses who are on the panel, and we didn't think about that in advance. But Feroze, if it's okay, I'll enter both yours and my email into the chat to everyone. I have volunteered him. And so you are welcome to reach out to us after this panel in addition so that we can move forward with discussions about what needs to happen next. And that was very much the goal of bringing all of these exceptional panelists together. And with that, Keith, I'll hand it over to you.
Thank you very much, Ruth. And on behalf of all of us at CUGH, I'd like to thank all of our outstanding panelists. I mean, you're more than panelists. You are actually, as many of the folks have said, you're all heroes. I know you would never probably consider yourself as such, but you are. And you give care and voice to the voiceless in ways and places that people don't see, but you do it because it's the right thing to do. And you have given yourself to do that. And so you're really an inspiration for the rest of us. I'd like to thank Elizabeth Hourani on my team who produces this, Elizabeth who co-created this and really did the lion's share in putting this together also. And finally, this session is going to be on our website in 2 weeks' time. It'll be shared with CUGH's network of 36,000 people worldwide. It'll be shared well beyond that in all of our other platforms. I would just encourage all of you to please use it. Conflict and war is a political failure, is a failure of politics, which means that all of us can actually mold and shape that in a different direction. People have to get elected, and it's we who are the electors who make that happen or not make that happen. So each and every one of you have a voice. Please tell the stories in the way that we've learned today of our speakers, how they've told stories. Share the voices of the voiceless, show their pictures, use visuals, and be persistent. Repetition is absolutely essential in what we do because that repetition, again, gives power and voice to those that don't have. And finally, for those who are in the region and are in the countries that could be helping out the people in Gaza and also in the other conflicts that we saw today, step up to the plate and help these people now. They need your help. They need your assets. Otherwise, they will not be able to have, I think, as Dr. Halawash said, the lives that they shouldn't deserve to have, like the rest of us want and deserve to have. So with that, thank you all for attending this session. Again, follow us at CUGH.org. Come to Washington next year. It's at our annual conference, and we hope to see you there so we can continue to work on this issue, which we will continue to do. Thank you so much.